Welcome everyone, it's Michael over here at Healthcare Educational Services, also with Home Health Success Academy. In this training session, we are going to be talking about Home Health Aide or Home Caregiver Certification Program. And what our main goal here is to be able to share with you as you are planning to start working in the home care, either non-medical or medical services. So for this training program, we're going to be going over everything that you need to know to be qualified to either work as a homemaker caregiver, or if you're a certified nursing assistant already, or a nursing assistant, or also known as a CNA, how you can actually apply the skills that you already have to work in the home health industry. So let's talk about this. What is home care? There is so much to know about the home care services and the home health programs that are out there right now. Okay, so let's go ahead and talk about this. Defining the home health services. From what is the purpose, what is your role, all the way to is who is in the health care team. So, home health care, home health aides especially, like you yourself working now or about to go into this industry. Home health aides provide assistance to the chronically ill, the elderly, and family caregivers who need relief from the stress of caregiving. Many home health aides or home care aides also work in assisted living facilities, which provide independent living in a home-like group environment with professional care available as needed. As advances in medicine and technology extend the lives of people with a chronic illness, the number of people needing health care will increase as the years go by. The need for home health aides like yourself will also increase. Now, what's the purpose of home care? One of the most important reasons for offering health care in the home is that most people who are ill or disabled feel more comfortable at home. Healthcare in familiar surroundings improves the mental and physical well-being. It has proven to be a major factor in the healing process. Now, as we dive in, we also want to talk about the healthcare team. Who are you going to be working with? Is it just going to be you at home with the client, with the family? No. There's a whole array of team members that is involved in caring for a person at their home, whether they come to the person's home or that particular person has to go out and go see their doctor, go see the specialists. But making sure and understanding that we need to know what are the roles of a home health aide or a home care aide, and we will discuss that later on further. But first, let's talk about the care team. First person is you, the home health aide. The home health aide performs assigned tasks, such as taking vital signs, depending, of course, on the policies and depending on the level of skilled care needed. If you need medical skilled nursing and you need to be an assistant as a home health aide, or are you just doing basic caregiving and homemaking programs where you're just being a person who's there for that client. Remember, you always must adhere to the policies and procedures, and at the same time as you need to be able to speak to your management team for them to let you know the level of care that you need to provide for the client. So, the home health aide, like I said, performs assigned tasks such as taking the vital signs. The aide also provides routine personal care such as bathing the clients or even preparing meals. Daily personal care tasks such as bathing, caring for the skin, the nails, the hair, and even the teeth, as well as dressing, toileting, eating, and drinking. And also providing assistance with transfers as well as assisting the person with walking and daily activities of daily livings, also known as the ADLs. The home health aide or home care aide spends more time with the clients than other care team members. They act as literally the eyes and the ears of the team. Observing and reporting changes in a client's conditions or abilities is very important for your duties. Now, you're also going to have those case managers who usually is a registered nurse at times, or even the person who owns the business that you're working for. That person or supervisor is assigned to each client by the home health agency. That manager will get input from other team members, create that basic care plan that's possibly needed for that client. He or she will monitor any changes that are observed and report anything that is reported to them by the home health aide or the team. Now, your client may be also being seen by a registered nurse. What are registered nurses, also known as an RN? In the home health setting, a registered nurse will coordinate and manage and provide care for the client as well. They will also supervise and train you if needed as well. And what they will do is they will also develop any assignments needed for you or for the team. There also is the doctor. The doctor will typically assign any services for the clients at the same time as will also make any changes in medication orders or if the client needs any additional services. The patient or the client may also need assistance with therapy, such as those physical therapists, occupational therapists, or even a speech language pathologist. Now, the patient may also need a social worker or even a registered dietitian. Another person or another group of people that is always not looked into as part of the services or care for the client is the client or the patient's family. The client is an important member of the care team as well. So understand that the client, the person you're with, has the right to make the decisions and choices about his or her own care. Their family may also be involved in these decisions. The family is a great source of information. They know the client's personal preferences, the history, the diet, their rituals, and even their routines. They may also be there to be able to provide any assistance as needed. All right, let's talk about some of the major changes in our healthcare industry, in the healthcare system, and they will include the following. There's an increased use of expensive technology, right? You have a lot of telehealth services now. You can actually speak to your doctor, with a cam, whether you're using Skype or whether you're using FaceTime with the Apple, the iMac. There's that rising costs of healthcare. Things are getting more and more expensive as services are being needed. And also, with the cost rising, we're starting to come up with new ways to be able to control the costs of the care. Let me ask this question. Can you think of some ways that recent changes in our healthcare system may have increased the demand for home health aides? One good way to answer that is this. There is changes. Number one is the baby boomers are getting old. Every day somebody is turning 65. Every day somebody's going to be needing more services, more care that you can actually provide, which then makes sure that you are in demand. Now, let's talk about some of the payer systems, some of the people that's going to pay the company you're going to be working for so that you can get paid, right? There's Medicare and Medicaid. You may be working for a skilled nursing home health agency. So you will have Medicare and Medicaid. What are the differences? And we want to be able to talk about that. Now, Medicare is a federal health insurance program for people who are 65 or older, are disabled, or are ill and cannot work. Medicaid, on the other hand, is a medical assistance program for low-income people, usually handled by the federal government as well as the state that you're in. I want you to know these facts of Medicare. For individuals who are 65 years of older, as we discussed earlier, also covers people of any age with permanent kidney failure or any other certain disabilities. Currently covers more than 43 million, which pays for literally 37% of all home care services. Now, there are 4 parts of Medicare coverage. Part A helps pay for a care of a client or a patient when they're in a hospital or a skilled nursing facility, or for care for a patient who needs skilled home health services or even hospice. Part B helps pay for the doctor services, those doctor visits, or any other medical services and equipments needed by the patient. Part C allows private health insurance companies to provide Medicare benefits. Part D helps pay for medications prescribed for any treatment. Now, for Medicaid, what it is a medical assistance program for low-income people. People qualify for coverage based on income and special circumstances. This literally pays around 19% of all home care services. Like I said, it's funded both by the federal government and as well as each individual state. So, let's understand what home health care, what coverage it has under Medicare paying. It covers any intermittent, non-continuous care. What that means is you're not going to have somebody that's going to be paid 8 hours the whole day to be with the client. So it's not continuous, meaning that most clients who's going to need home health services, skilled nursing that is, that's going to be paid by Medicare, will have typically 60 days of services. The agency that's providing the care, that's providing the services to that patient, to that client, must be certified by the federal government to be able to bill Medicare. Now, this is important because they pay your agency, then of course your agency pays you. The recipient must be homebound, unable to leave the home. Now, what we say about homebound is that doesn't mean that they cannot literally walk, they need to be bedridden. No, they must have certain categories met. And one of the things is pretty much having difficulty taxiing from home. Okay? And also, they must be under a doctor's care. A doctor must sign out the patient and must write an order that the patient needs home health services. Medicare does not cover round-the-clock home care. All right, so let's understand the purpose of home health care again. Hospitals discharge earlier nowadays, right? You're hearing all these news how hospitals are literally discharging people even though they should still be at home or should still be at the hospital. So the patients are being discharged home, but the patients may still need some care. Many patients who are discharged have not even recovered fully. They haven't recovered, their strength has not recovered with their stamina as well. So patients will need some form of short-term care at home. And also, it's less expensive to care for the patient at home than care for them in the hospital. Now, most insurance companies are willing to pay for a part of this care because it is less expensive, of course, than the patient or the client staying longer in the hospital. So let's look at why the need and demand for home health care services is increasing. A lot of family members don't even live in the same state, don't even live in the same country. Or even if they did live in the same state, what ends up happening is they're busy with their lives and they can never be there fully for that particular client or patient. A lot of older people, a lot of seniors, they prefer care at their home. It makes them feel better. Longer lives increase chronic illnesses. So as we get older, illnesses will happen. Look at a car. As long as you have a car, you keep on having it, you may still take care of it. You might still change the oil. You may flush the system every now and then, but eventually it does break down. Parts needs to be changed. Just like a person, as we get older, chronic illnesses will start happening and we may need more care, more therapy, more treatment. Now, disabled people also are more comfortable at home. So, when we provide services at home health or home care, we're not just providing for seniors. We may be providing services for pediatric clients with some illnesses. And when we talk about pediatric, we're talking about children. We also may take care of people who are disabled, handicapped. If you ever needed additional care and had a choice, would you prefer to receive care by living in a long-term care facility? And when we talk about long-term care, we talk about nursing homes. Or would you choose to live in your own home if you could get the services there instead? Home care has changed a great deal over the years. And the first home health aides were women hired to care for the homes and children of mothers who were sick or hospitalized in the early 1900s. Before we know where we need to go and where we need to be, we need to know where it all started with. And this is a good way to look back on this. Around 1959, the National Conference on Homemaker Services was established. So let's look at the history, right? 1965, Medicare was created. It wasn't that long ago when Medicare was created. If you look at it's literally, over 50 years. 1999, CMS issued new rules for home health agencies. A lot of agencies will require to have criminal background checks. Most of them are mandated, some of them are not yet, depending on the state. All right, these two things is very important to know, especially the second one first. The first one is DRGs, or diagnostic related groups. This is more related to medical or skilled nursing home health agencies. What it is specifies the treatment costs Medicare or Medicaid will pay for various diagnoses. This is important if you're an owner of a home health agency because You want to be able to make sure you get paid for the services so you can pay your patients. You can pay your staff, your home health aides, your nurses, and so forth. Diagnosis is good to know as well. It's the physician's determination of an illness. So, an example, diabetes, that's a diagnosis. Congestive heart failure, that's a diagnosis. So, you want to be able to know when you're caring for someone, what are the diagnoses that they have? What additional care may be needed to be given to them? So, a DRG, a hospital, if you didn't know this, will lose money if a person stays in longer than what is allotted in the DRG, meaning they're not going to pay them if they stay any longer. So they're going to make more money if a patient can actually leave early, right? So henceforth, early discharges. So when there's early discharges, guess what? Increases care for home health services. So know that any of the following may pay for home health services. We talked about Medicare, we talked about Medicaid. There may be grants also provided by state and local governments. You have your private insurances like your Blue Cross, your Blue Shield, and those other things like that. Or you may have private pay clients. Those individual clients may have money that needs to be able to pay for the services or their family members. Remember, we discussed this earlier. Medicare is a major influence as a payer for home health services and accounts for 37% of all home care that is provided. So what are home health agencies? Right? You have businesses that provide home health care and personal services at home, whether it's non-medical, whether it's medical. Clients who need care are referred to a home health agency by their doctor. Now, this is for skilled nursing. For some of the clients who need basic home care, basic caregiver services, basic homemaker services, they do not need a doctor's orders. That is the patient saying that they need it. That is their family member that says that they need it. For medical, they may also be referred to you by the hospital, discharge planner, or social service agencies, or any welfare, or as well as family members. Working in someone's home differs from working as a nursing assistant or a nurse's aide in many ways. It is very important to respect the client's homes, their routines, and ways of doing things. Remember, when you're working for a client at their home, you are a guest at their home. So you want to make sure that you always, and you should, respect their home. All right, let's look at this. Understanding how these aspects of working in someone's home are different from working in other areas. Typically, if you worked in a nursing home, you wouldn't have to do housekeeping services. There's a housekeeping team that will do that for you. Now, you will have to change the bed, but when you work in a home health setting, you are the housekeeper at times. You are the one changing the bed. You are also the person there to provide contact with the family if needed. You want to be able to increase the independence for your client, and at the same time as you have to be independent yourself. There's nobody there. There's no manager with you right there and then. So you need to be able to control the setting. Yes, you may have your manager, your case managers at the office that can answer some basic questions, but you're the front runner. You're the person in there right now with that client, with that patient. You must have good communication. Good communication skills by communicating with your team, the RNs, the case managers, your office, whoever, but at the same time, it's good communication with the patient, with the client, and also their family members as well. You may need to provide transportation services. It all depends on what is required. It may not be you as a home health aide who has to drive the patient around, or your facility may provide that, or a third-party company may come in and provide the transportation services. Now, remember that we have to be looking into safety a lot. We must provide safety. We must have that safe environment for yourself to avoid any injuries, but also to avoid any problems or injuries for your client or your patient. You must show flexibility. Remember, working in this industry, you have to have that can-do attitude. You must understand your working environment. You must understand what you're surrounding yourself with. You must understand that you must provide comfort for the client. That's why you're there. They are not there to inconvenience you. They are there because you have a job. And you need to make sure you respect their homes. So why should you know this? Well, let's look at this. Why should you know professionalism? Why should know about ethical behaviors? So, what is professionalism? Professional means having to do, with work or a job, okay? It has to do with that. The opposite of professional is personal. Personal refers to life outside a job, such as family, friends, and home life. Professionalism is about behaving properly when you're on the job, when you're doing something. It includes dressing appropriately and speaking well. It also includes being on time, finishing assignments, and reporting to the supervisor. Now, for a home health aide, professionalism means a lot more. It also means following the care plan, making important observations, and reporting accurately. Following your policies and procedures is an important part of professionalism. Clients, coworkers, and supervisors respect employees who behave in a personal way, as well as a professional way. Professionalism helps people keep their jobs. If you're not professional, do you think you're going to keep your job? How many people do you know have lost their positions because they were not professional? And also understand this, a professional relationship with clients will include some of the following: keeping a positive attitude, arriving on time, finishing your assignment, doing the task that is assigned to you, keeping the client's information confidential, being polite and cheerful at all times. Remember, you're that person who's supposed to make this person feel good and may want to keep on working with your company. If you're not professional, you're going to lose the client. And when you lose the client, you lost your position until somebody else can get you another client. So you need to be able to make the most about what's in front of you and how to be able to provide great care to them. Professionalism is also not discussing any personal problems. Don't share that with your client. Not making personal phone calls or sending or reading text or emails when working. When you're on the job, when you're in that client's house, your phone should not turn on. Not unless there's some emergency at home, that's the only time you should be texting or answering the phone. There should be a no phone policy when you're working with that client. You want to be able to avoid using profanity. Listening to client is a must. You should never ever accept any gifts from the client unless it's approved by your agency. Always explaining the care that you're providing before you start it. You need to follow practices such as hand washing to be able to protect care providers and clients and to avoid any infections. Now, let's talk about professional relationships with your employers, okay? You want to be able to complete those assignments, right? Make sure that you always follow the policies and procedures. I'm going to repeat that. Make sure you follow the policies and procedures. You want to make sure that you become that positive role model. You want to be able to participate in educating yourself to learn what else can you do to make it better. You want to follow the chain of command. You want to make sure that you're clean and neat. You want to be able to make sure you're dressed properly. You want to be able to follow whatever your policies and procedures are regarding your dress codes. These are very important to know. Now let's move on to being ethical and looking at the legal aspects of things. Ethics and laws guides the behaviors. Ethics are the knowledge of right and wrong. An ethical person has a sense of duty towards others. He tries to do what is right. Now, the laws are the rules set by the government to help people live peacefully together and to ensure order and safety. Ethics and laws are very important in healthcare. They protect people receiving care and guide those giving care. Home health aides and all care team members should be guided by the code of ethics. There should be a code of ethics that is given to you under your policies and procedures. So let's look at the basic guidelines for legal and ethical behavior. Now, be honest at all times. Protect clients' privacy and confidentiality. Report abuse or suspected abuse. Follow the care plan and assignments. Do not perform any unassigned tasks or tasks outside your scope of practice. Report all client observations and incidents to the supervisor. Document accurately and promptly. Follow rules on safety and infection prevention, including the OSHA rules about bloodborne pathogens, standard precautions, and tuberculosis. Do not accept gifts or tips. Do not become personally or sexually involved with clients or their family members or friends. And Do not bring friends or family members with you to the client or their home. And lastly, turn off your phones. No texting, no phone calls unless it's an emergency. So what is HIPAA? Have you guys heard what HIPAA is? You're going to be exposed to the client's and the patient's information. It's going to be laying around the house. It's going to be out there. So we need to understand the rules of HIPAA. HIPAA also stands for Health Insurance Portability and Accountability Act. In 1996, it was approved. It has been further defined and revised since then. Congress passed this law to help keep health information private and secure. All healthcare organizations must take special steps to protect health information. Their employees can be fined and/or imprisoned if they do not follow special rules to protect the privacy of the client. Under HIPAA, a person's protected health information must be kept private. Examples of protected health information will include the name, the address, the telephone number, social security number, email address, and medical record number. Only those who must have information to provide care or to process records should know this information. They must protect information so it does not become known or used by anyone else. It must be kept confidential. All right, let's talk about and describe the roles of the home health aide and explain typical tasks that are performed. Know the ways home health agencies or home health aides provide services to clients. We must understand that providing care or assisting with self-care is very important in what we have to do. We must maintain, as a home health aide, a safe, a secure, and a comfortable home life. We need to be able to promote the client's independence by practicing good housekeeping, nutrition, and healthcare skills. So what is in the scope of practice? Scope of practice defines the tasks that the healthcare providers are legally allowed to do and how to do them correctly. You must know what your duties are and what you're allowed to provide. And this is something that is going to be shared with you by your agency, by your company, by the person that you're working with. Remember that these tasks are outside the scope of practice of a home health aide. Administering medications, inserting or removing tubes, doing something outside the scope of practice, performing procedures requiring sterile techniques, diagnosing or prescribing, and telling client the treatment plan. To know which procedures are within your scope of practice, remember, follow your state's and agency's regulations. Remember these facts about how the client care plan is individualized for each client. A care plan is something that is provided, which is pretty much a plan of care. How are we going to provide care for this client? What services, what products, what programs are we doing for this person? It is developed to help achieve the goals of care. It lists tasks that team members, including home health aides and home care aides, must perform. It states how often these tasks should be performed and how they should be carried out. Now remember, when we're formulating a care plan, we need to look at the client's health and physical condition, their diagnosis and their treatment, the goals or the expectations wanted for this person. Other needed services and resources such as transportation, equipment, and additional income may also be looked into. All right, policy and procedures. You've heard me say this before. Policy. A course of action that should be taken every time a certain situation occurs. Procedure. A method or way of doing something. So, you need to make sure you read your policy and procedures, not just say that you read it and just sign that piece of paper. Read it and know it. And if you don't know something and you're not sure, make sure you ask first. You need to make sure you know these following, especially the information confidentiality stuff, how to follow the care plan, how to report to a supervisor, not discussing personal problems, being punctual and dependable, following deadlines for paperwork, giving care in a pleasant, professional manner. And remember, once again, not giving or accepting any gifts. Remember, in order to finish all your assignments each day, you must work efficiently. In order to be efficient, you need to decide the order in which to do your tasks. Regular grooming makes you also feel good, so make sure you are neat, you take care of yourself as well, and it also makes others feel good about you. Have you ever been uncomfortable when you sat next to a person who kind of stank a little bit? Just to be, not to be mean or not to be rude, but how does it feel when you're sitting next to a person who needs a bath? how you just wish you could tell the person you need a bath. But it's hard. Remember, grooming affects how confident clients feel about the care you give. If you are looking really messed up and you're providing care, that person may not really have a good positive outlook on you as a person. Now, bathing or showering daily as a person, all right, and also making sure you're using deodorant or antiperspirant is also good as well. When you're providing care, try to avoid using perfume or cologne. And if you are using that, because remember, it may be intolerant for some clients. Some clients may not be able to work well with this. They may have a bad allergy on this. So, but at the same time, as if you choose to use cologne or perfume, make sure that it is not too much, okay? Where it's just overwhelming. You need to make sure you brush your teeth frequently and using mouthwash when necessary. Remember, you're with this client sometimes for 8 hours. After you eat, brush your teeth. A lot of people will say, well, why should I bring my toothbrush with me to work? You should bring it with you, and you should bring toothpaste as well. You need to make sure your hair is kept clean. Okay, when you're working, you want to have and show and demonstrate personal grooming habits. You must clean your hair. You must shampoo it. It must not look oily. It must be neatly brushed and combed. If you have long hair, you need to be able to tie it in the back or have a bun or a ponytail. If you have facial hair, you must keep that short, gentlemen. You must be able to make sure it's clean and neat. And you must look presentable. Dressing neatly in a uniform that has been washed or ironed is a must if you're provided a uniform. If no uniform is provided to you by your company, then look at the policy and procedure and what you're allowed to wear and not wear. Remember, not wearing clothes that are too tight or too baggy, torn or stained, or too revealing is a must. Short skirts, low-cut blouses, see-through fabrics is a no-no. Also understand is you must not wear any large jewelry. The main exception to this rule is pretty much to wear a simple, waterproof watch that may be used to take vital signs and record events. Remember, if you have large jewelry, this may cause problems and may cause injuries on the client when you're providing care. Any visible tattoos and extra piercings may be asked to be removed depending on your policies of your company. Now, you must make sure that you wear comfortable, clean, high-quality, closed-toe shoes. And the reason why closed-toe shoes are important is because it helps avoid any additional injuries. You might stub your toe, or something may fall on it. You need to be able to make sure you keep your fingernails short, smooth, and clean. Why is that? Your fingernails may cause you to scratch the patient. Or at the same time, if you didn't know this, that your fingernail beds are one of the highest places of bacteria that grows. They harbor bacteria. There's little cracks that happens when you have your nail polishes done. If you don't see them, there's little crevices there that gets moist, and that's where bacteria love to grow. Wearing little or no makeup is also a must as well. You don't want to overdo it. Remember, you're not going into this person's house to start a pageant. Okay, you're there to provide care and services. Now, we talked about this earlier on about ethics and laws, and I just want to be able to review it again. Ethics, the knowledge of right and wrong. Laws, the rules set by the government to help people live peacefully together and to ensure order and safety. Now, you want to be able to make sure you're honest, you protect the client's privacy, reporting abuse or suspected abuse, follow the care plan, and also you don't perform any tasks outside the scope of practice, okay? We talked about this earlier on again, how to document accurately, make sure you're reporting observations, do not accept any gifts. I think that's the third time I already talked about that. And not being personally, sexually, or emotionally involved with the patient or the client or their family members. Let's talk about neglect and active neglect. Okay, neglect is harming a person physically, mentally, or emotionally by failing to provide the needed care. Active neglect is purposely harming a person by failing to provide the needed care, where you literally do it on purpose. Passive neglect is unintentionally harming a person physically, mentally, or emotionally by failing to provide the needed care. Negligence, on the other hand, is actions or the failure to act or to provide the proper care resulting in unintended injury to a person. Two more terms to learn is malpractice and abuse. Malpractice is injury to a person due to a professional misconduct through negligence, carelessness, and lack of skill. And this is where you need to educate yourself continuously. This is where you need to pay attention, and that's why sometimes as you're hearing a lot of people getting into accidents because they're not paying attention, because they're careless, because they're in their phones texting while they're driving. Same thing as when we're caring for a client. We need to give our full attention to them and not keep our head elsewhere. Abuse is purposefully causing physical, mental, or emotional pain or injury to someone. Physical abuse is intentional or unintentional treatment that causes harm to a person's body. Psychological abuse is any behavior that causes a person to feel threatened, humiliated, intimidated, isolated, or insulted in any way. Verbal abuse, as what it may say, is spoken or written words, pictures, or gestures that threaten, embarrass, or insult a person. And assault is a no-no, gentlemen and ladies. It is the act of threatening to touch a person without his or her permission. And this is just threatening, okay? If you threaten someone to touch them, to hurt them, to inflict pain without his or her permission is an assault already. You don't have to touch them to get an assault charge. Battery, on the other hand, is when you actually touch the person without his or her permission. Sexual abuse, of course, forcing a person to perform or participate in sexual act against his or her will. It includes unwanted touching, exposing oneself, and sharing pornographic material. It is unfortunate that these events has happened, that there are sexual abuse, that there are battery, that there are assaults in our industry. And we need to be able to make sure that we put a stop on that by us not doing it, and also by reporting other people that we see do it. Remember, home health aides must never abuse clients in any way. They must also try to protect their clients from others who abuse them. If you ever see or suspect that another caregiver or family member is abusing a client, report this immediately to your supervisor. Reporting abuse or suspected abuse is not an option. It is the law. Okay, let's talk about elder abuse and neglect. In 1996, approximately 500,000 older persons were abused in the home setting. For every reported case, approximately 5 more go unreported. Reasons are ignorance, inexperience, or inability to care for the elders. Types of abuse are physical, psychological, sexual, verbal, financial, and material abuse. Elders may be deprived of rights by others as well. Neglect may be failing to provide food, clothing, shelter, or medical care. Older adults may become self-abusive or neglect their own needs, and we need to be able to make sure we provide that for them. As a home health aide, as a home care aide, you are the best position to observe and report signs of abuse and neglect. You're the first responder. You're there with the patient. You're there with the client. You're there exposed with the family members. Now, let's go ahead and list ways to recognize and report elder abuse and neglect. Now, we need to understand the reasons why the elderly and disabled are vulnerable to abuse and neglect. The reason for that is they're unable to stand up for themselves. They're unable to report abuse or neglect to others. They may not understand what they have as rights. They may be more demanding to care for. That does not give the right for anyone to abuse them. Now, caregivers may not be trained properly to care for them. And this is where the family members are also involved, but we need to train them to what to recognize, to provide care for their patient, their loved one, their mother, their father, their uncle, their grandma, their grandpa. Caregivers may not even understand their own behavior. Caregivers may be overworked, tired, stressed, and unappreciated on top of caring for someone who requires so much time and energy. So, the following behaviors support clients' rights. Okay, we need to talk about the rights of a patient, the rights of a client. They have the right to never be abused. They have the right to observe and report. They must be called by the proper name. They must involve clients in planning. We must explain the procedures before we do anything to them. They have the rights to all this. So some of the behaviors that supports the client rights also, in addition to what we just did in the last slide, was respect refusals and report to supervisor. If a client says, I don't want to take the medication, they have every right to. Your job is to just now report it or chart it if need be, or if that's what is needed of you. You need to be truthful to them. You must not gossip about the client or with the client. Before you enter any room, just because you're already in the house, that doesn't mean you can just enter any room. Knock before you enter any room. You want to be able to provide and allow them the possibility of, just because they're in their home, still that privacy. Having that privacy is still very important. And most of the time, that's why they want to stay at home. Because if they go to a nursing home or sometimes an assisted living, they're sharing the room with 2, 3, or even 4 other people at times. Remember, never open up their mail unless they ask you to. Remember, once again, 4 times, do not accept gifts or money. Report any questionable financial practices. Respect their property, and also report any observations you have. We talked about HIPAA earlier as it applies to all healthcare providers. Once again, there are serious penalties for violating these regulations. Penalties will differ depending upon the violation and will include fines ranging from $100,000 to $250,000 and or prison sentences for up to 10 years. Maintaining confidentiality is a legal and ethical obligation. It is your duty to become a person that respects their confidentiality. It is part of respecting your client and their rights. Discussing a client's care or personal affairs with anyone other than your supervisor or another member of the care team will violate the law. Moving on to advance directives and living wills. Advance directives are legal documents that allow people to choose what medical care they wish to have if they cannot make those decisions themselves. A living will is a document that states the medical care a person wants or does not want in case he or she becomes unable to make those decisions, him or herself. A durable power of attorney for healthcare is a signed, a dated, and a witnessed legal document that appoints someone else to make the medical decisions for a person in the event he or she becomes unable to do so. A DNR is an order that tells medical professionals not to perform CPR. Now, if you are working as a homemaker or a home care aide for a non-medical, a private duty company, just because you know a patient has a DNR, that does not mean you call 911. You do not call 911. You still may have to call 911. Remember, you're a home health aide, you're a home care aide, and you cannot make a decision for this patient, for this client. Also, make sure you refer to your policies and procedures on what is needed to happen when a person is needing CPR or cardiopulmonary resuscitations. Now, we covered a lot in this chapter, and I'm glad that we were able to share with you guys the different information needed from your ethical and legal duties as a home health aide, as a home care person. Also discussing what kind of services you may look into the future that you must provide when you're with the client at their home. Now remember, as this series keeps on going, you're going to be required to take some form of examination after each section. So make sure you pay attention, and if you need, just keep on watching the videos all over again. And if you also would like, we will provide you also some copies of our PowerPoint presentations that you can actually go through to make sure you can keep on reviewing. Now, we look forward to keep on working with you and hope that you stick around and finish this whole course.